What did you make of that? There had been, it seemed, an invitation going out where the PM and the opposition leader would do it together, and then that was kiboshed for whatever reason. Was there a missed opportunity there?
Look, it's really a decision for the Prime Minister, and I was ready to go. I've volunteered to get the vaccine as part of getting that public health message out, that people with underlying health conditions can be assured it's safe and should get the vaccine. And I was ready to go whenever that opportunity arose, and I guess you'd have to ask the Prime Minister why we didn't all do it together. But look, it's not about that really, it's about getting the message out to people that the vaccine is safe, and it's important that you take it for your health.
Are you annoyed about that, Peter? Or are you annoyed about the decision that was made?
No, I'm just, as I said, volunteering to put myself forward to do all that I can to get that public health message out. And as I said, I'm part of this particularly to assure people with underlying health conditions, because I have one. I have, as most people know, I have metastatic breast cancer, and essentially I want to say, look, I'm not asking you to do anything that I'm not prepared to do. I've spoken to my GP, I've spoken to my specialists, and it is absolutely safe. And that public health message is just so important.
So you have no concerns at all, Peter?
No, I'm very, very prepared to trust the science, to trust my doctors. What people should do if they have concerns is do what I did. Go and talk to your doctor, talk to your GP or your specialist, and make sure that it's safe for you. I'll be taking it. I'm taking Pfizer, so there'll be 2 rounds, and I will obviously make sure I monitor myself and keep in touch with my medical practitioners. But it's important that that message gets out, that it's for your public health, your health, that you take the vaccine, and it's also really important for your wider community. And if I can do anything to help assure the Australian public, then I think it's my responsibility to do that.
Have you got ongoing treatment that's taking place as we speak, Peter, as well, or is that kind of done for now?
No, yes, I have.
Yeah.
I have.
So your doctor
treatment.
Yep. Sorry. So your doctor has basically said, because that treatment is done now, you are okay to take this vaccine, but perhaps that might be a different message for people who are still undergoing treatment, if for whatever reason.
No, I'm sorry. I'm sorry. You misunderstood. I am still undergoing treatment.
Yeah, okay.
And because of the nature of the cancer that I have, I will always be on hormone therapy and another drug. That's just my situation, that I'm always on treatment. So I've checked to make sure that, given that I'm on that treatment, it is safe for me to take the vaccine. And there's also, what we need to remember is that a lot of people with underlying health conditions therefore have greater vulnerability to catching COVID. But just as importantly, if they do get COVID, not as many resources to be able to fight it off. And that's the importance of going and making sure that in your personal circumstances, you are okay and you should be taking the vaccine, because even when we have, that magical thing that everyone talks about, herd immunity, if you are someone with an underlying health condition, which means that if you do get COVID, you are less capable of fighting it off, then you want to have that reassurance that you've taken the vaccine. Okay,
Peter Murphy, misunderstood your question there, your answer then, but we got around there. We got there in the end, but you're going out and you're getting your COVID jab today with the opposition leader as well, and hopefully that all goes well and trying to boost confidence for people out there as well. So I appreciate you doing that. Thanks for joining us this morning, Peter Murphy.
Thank you for having me on. I appreciate it.
It's our pleasure.